Hello and welcome to this edition of Middle East Matters, shot on location this week in Istanbul. Turkey's biggest city and economic capital is home to the largest number of COVID-19 cases in the country. It's also on lockdown on the weekends, like 30 other Turkish cities. This is Istiklal Avenue, famous for its shopping, cafes, restaurants, and bars. On any given day, pedestrians have to push through the crowds, but as you can see, it's almost empty. 2020 is shaping up to be a terrible year for tourism, one of Turkey's biggest economic sectors. And it's precisely for economic reasons that the government here has quarantined only those under 20 and over 65. Everyone else has to keep working from home if they can and on site if they have to. Turkey has few monetary reserves. The lira still hasn't bounced back from the 2018 currency crisis, and it's launched several military operations in the last few years. Turkey now has the highest number of COVID-19 cases in the region, but its official death toll is still significantly lower than in many other countries. To find out why, let's talk to Pınar Sayip, representative of the Turkish Medical Association and head of the Istanbul Medical Chamber. Thank you for speaking to us, Mrs. Sayip. The Turkish Medical Association, or TBB, has noticed that the daily number of deaths has more or less stagnated, even though the number of new cases continues to rise every day. How is that possible?
According to the recommendations given by the World Health Organization, there are two categories of cases. People who tested positive for COVID-19, but also those who are potentially infected. That's when all the clinical exams, MRIs, symptoms, etc. point to COVID-19, but the test itself is negative. The WHO has guidelines to care for both kinds of patients. The number of deaths in Turkey appears rather low because it doesn't include people who are potentially infected. It's become a standard procedure around the world. In many countries, they record not only those who tested positive, but also those who are potentially at risk. That's still not the case in Turkey. That's why we do not have numbers of the exact number of cases or deaths from COVID.
Hem ölümlerin sayısı hakkında hem de vakaların sayısı hakkında net bir bilgi sahibi olamıyoruz.
Why is it so important that we have a precise idea of the number of cases and dead?
Çünkü o zaman vakaların yaygınlığını görebileceğiz.
It allows us to understand how far the virus has spread. When we have precise figures, we can make future estimations, especially for health professionals who are specialized in public health. That way, clinicians have a clear view of the situation to take necessary preventive measures. That's why it's so important. It's also important to compare the trajectory of a country with other countries. And finally, it allows us to know the reality of the situation on the ground.
Bir de gerçekleri tam olarak bilmek açısından da önemli.
How would you describe the measures that have been taken by the Turkish government so far in the fight against this pandemic?
Bizim sağlık sistemimiz
Our health system performs well in terms of healing patients. The situation is satisfactory with regards to the number of beds we have, the intensive care structures, and the treatments given. But what's essential during this period is to be sure that people don't get sick in the first place.
Yani o da tedavi edici hizmetlere değil de
Instead of counting on healing and emergency measures from the outset, we need to put in place preventative measures before then. We need to suspend all non-essential and urgent procedures for a period of 15 days. If we had done it sooner, we would have limited the spread of the virus. It's a question of resources. The professional chambers, the different political parties must be consulted and must participate in this crisis management. Unfortunately, this pandemic is being managed from higher up in our country. We have to get past that. That's the only way we can fight the virus more effectively.
Anlayış var. Bunun aşılması gerekiyor. O zaman daha başarılı oluruz.
Thank you, Mrs. Sayip, for answering our questions.
I thank you.
Now let's head to Israel, where the Jewish ultra-Orthodox community is the hardest hit by the pandemic. Its members have also largely refused to obey social distancing directives ordered by the Israeli government. Iris Mackler, Antoine Mariuti, and Cécile Galuccio report.
There's barriers, ribbons, and sometimes even padlocks. This district is a red zone, a coronavirus hotspot. It's been cordoned off, and so has its population.
We're going to visit the different roadblocks that there are in order to make sure that everybody is inside and nobody can make a movement in or out.
Even in ordinary times, Mea Shearim is a kind of enclave, an ultra-Orthodox community living by its own rules. Black hats and jackets for men, modest outfits for women. Traditional Jewish law governs all aspects of their lives. The birth rate here is an average of 7 children per woman. Many live below the poverty line.
The people inside the communities, they're very isolated. They don't have televisions, they don't have iPhones. So what is happening is our units are speaking to the rabbis and making sure that the rabbis get the message to the community.
For several weeks now, that message has been stay home, and if you go out, wear a mask. But this community generally listens to its rabbis and not the State of Israel.
What I'm going to do is we're going to drive through. I'm going to flip over the number of my vehicle so it'll be a plain vehicle car, not a police car. So what happens is that they recognize someone in blue uniform, Israeli national police officer, and they could possibly stone the car. There's a lot of tensions in the communities, but that is something that we've been dealing with for years. But now, during the coronavirus period, it's felt even more.
Indeed, this neighbourhood goes from being inhospitable by day to downright dangerous at night. Many continue to live exactly as they did before the virus. They go out, meet, demonstrate, and the rate of infection here is up to 8 times higher than the rest of Israel.
אני הסברתי לך, אני גר פה, אני רוצה, הסברתי 1000 פעמים, אני הסברתי 1000 פעמים, אני גר פה, אני רוצה נשום אוויר, תסביר לי למה אתה נותן לי דוח. אני רוצה נשום אוויר, אין פה 10 אנשים.
The cat and mouse game continues. They hurl insults and stones and sometimes also bags of urine from the balconies. Israel has begun to relax some confinement measures, but the pressure here continues. These officers will probably chase the same demonstrators at dusk tomorrow.
Turkey is one of the biggest producers of masks in the world. There's no shortage of them here, but to avoid speculation and counterfeiting, the Turkish government has decided to distribute them for free. Individuals who receive a text message with a code can go to any pharmacy and pick up 5 masks every week. But other countries in the region are offering their residents less protection, if any. We spoke to the Rojava Information Center in northeast Syria, where a Turkish military operation took place last October.
The effects of corona in north and east Syria could be especially disastrous due to lack of resources and external aid. Recently, a few PCR machines for testing for corona have been acquired, but these were purchased by the Autonomous Administration, who have received no help from the World Health Organization, who is providing aid to regime-controlled areas such as Damascus and Idlib. But even with these PCR machines, there are still a lot of needs that aren't being taken care of. There are only 40 ventilator machines for 4 million people. Also, the situation in the refugee camps is really dire. It's very crowded, and if corona gets there, at very least, it is expected 10% of the people in the refugee camps will die. Also, Turkey and its proxies have frequently been cutting off water supply to Hesekay, leaving approximately 1 million people without water, unable to practice necessary hygiene.
Meanwhile, the Education Ministry here in Turkey announced remote learning back in mid-March. Now, up to 17 million pupils are adapting to their new classrooms behind a TV or computer screen at home.
4, 3, 2, 1 kayıttayız.
Merhaba çocuklar. Ben Zeliha.
This Istanbul classroom has been transformed into a TV studio. Today's program is for young children.
Televizyon izliyorlar.
In Turkey, the state is teaming up with public television channel TRT to air lessons during the pandemic.
3 tane sıfırdan kanal kurduk. Kaydedilen dersler sonra bizim yayın merkezlerimizdeki kurgu setlerine gidip montajlandı ve yayına hazır hale getirildi.
Schools have been closed since March 13th. The Education Ministry set up the EBA program that offers learning materials on the internet and classes on the web and TV for those with no access to the internet or a computer.
Öncü ülkeler arasında yer alıyoruz diyebiliriz. EBA Gov.tr'yi, EBA TV'yi çok hızlı biçimde 1, 2, 3 hafta içerisinde biz inanıyoruz ki bu kompozit sistem dahilinde kimse dışarıda kalmıyor.
Sheila isn't in the public school system. Like all the students of the prestigious bilingual French Saint-Michel High School in Istanbul, she's been given her own tablet.
Do you feel like it's harder to concentrate?
Oui, bien sûr. Car, par exemple, le téléphone est à côté de moi, il y a des messages qui viennent et tout. Quand on fait quelque chose à l'école, le prof voit et il nous dit « fais pas ça » et tout. Mais quand on est ici, il ne voit pas et on fait ce qu'on veut.
The school gates remain closed, but the building isn't entirely empty. The director continues to teach from behind a screen.
Bonjour. L'école va changer. Tout ce qu'on pouvait faire en fait à l'école, finalement, pourrait être réenvisagé éventuellement à distance. Et là, les équipes pédagogiques en ont pris conscience.
It's a view of education that's gaining traction in Turkey and abroad, and some wonder whether the coronavirus crisis will turn classrooms into relics of the past. That's it from us here in this special edition of Middle East Matters from Istanbul. We leave you on the shores of the Bosphorus. Do take care. There's more news coming up on France 24. Do stay with us.
At a time when most of humanity is confined because of Covid-19, France 24, more than ever before, is your window onto the world.
Liberté, égalité, actualité.